It's like Space Mountain in Disney World.
Here we go. 4, 3, 2. Hello, everyone, and thank you for joining another BlackTree webinar. We're very excited today for our panel discussion on the evolving role of technology in home health and hospice operations. As you all know, there's definitely been an added focus on technology in 2020 due to COVID and the home health and hospice space. And we had a whole other panel discussion earlier this year focused on telehealth and its evolving role in this space. But we wanted to discuss other technologies that agencies are using and starting to embrace more, not only for patient care, but for daily operations in general. So before I introduce the panel that I have today, I wanted to quick over some brief housekeeping. As you all know, if you've attended our webinars before, we do have a chat feature. So if you have any questions throughout, please put them into that chat feature or in the Q&A section. And then throughout, we like to be a little interactive here and have some polls that go on throughout the webinar. So we'll have those polls that will pop up, and I'll alert you when those questions will be popping up. It's always good to see and interesting to see what those results of the polls are the day after. So the other housekeeping is that we will be recording this session. If you registered for the webinar today, you'll be getting an email tomorrow with a recap highlighting some of the discussion points, some quotes, and then also those poll results. So without further ado, I'm going to introduce our panel here today. And they're each going to describe, who they are, what their role is, the organization they work with, how long they've been there, and give a little bit of background on the company. So I have Elliott, Rob, and Don with me. I'm going to start with Elliott, if you want to take it away with the intros.
Yeah, thank you, Nick. And just first of all, major thanks to the BlackTree team and Nick for hosting us, and really excited to be here. So my name is Elliott Wood. I'm the president and CEO of Metalogix. Metalogix is a data science company. We focus really all of our time today on creating data science and products that leverage data science for the home health industry. And that looks like trying to help our customers solve problems with the data that we're getting from their EMR around utilization management, how much utilization, how much care should a patient receive, how to intervene when a patient is at risk for hospitalization, which patients are likely on the wrong service line because they have high risk of mortality and may be better suited for other service lines, and which patients should you follow up with after they discharge because they're at high risk of decline. And so our mission really is around trying to ensure that every patient gets what they need based on the data that the agencies are collecting. And so that's a bit about Metalogix.
Great. Thanks, Elliott. Don?
Thanks, Nick. So my name's Don Spiers. I'm a senior product manager with Reliance. I've been with the company for about 5 years, and I have about 5 years prior to that of experience working in home and community-based services. I'm really excited to be here today, talk a little bit about what's going on with Reliance. For those who don't know, Reliance has about 20 years of experience in the learning industry. We are first and foremost a learning company. We do a little bit beyond that at this point, but we got our start in compliance and quickly moved beyond that to deliver things like personalized learning, targeted training, best practices, just-in-time learning, lots of different tools to have in an organization's tool belts to help them ensure that their staff are well-rounded and competent. At the end of the day, if we can help our customers stay compliant, deliver better outcomes, and develop a healthier financial result for their organization, we're doing our best. Our mission, though, as a company, it's been the same since its founding, but we strive to measurably improve the lives of the most vulnerable members of society and those who care for them. If you're ever on a Reliance webinar, you'll probably hear that a dozen more times.
Great. Thanks for being here, Don.
Thanks,
Last but not least, Rob?
Hey, Nick. Thanks for being here. Good to be here with Elliott and Don. So Citus Health is a organization that I'll refer to us as a virtual patient care platform, our CEO and co-founder. is a nurse and was a nurse doing home visits in the infusion world, and really was dealing personally with a lot of this. And to top it all off, she's a nurse in the middle of Manhattan in New York, right? So when we start talking about COVID, she's been right in the center of things. But we've been around for a while in different spaces. We're happy to be here because the problems that we solve are really that. And for about 4 years now, we've been talking about what do you need to be able to care for patients virtually. And so all of a sudden that has really come to the forefront, which is great. Not the way that it came about, but of course, now that we're here, we got to be able to talk about it. And so happy to be here and join them. I would just caution the viewers that if you hear comments along the way, there might be some ageism. You might want to keep your ears open for ageism taking place between this panel and myself. So just be aware of that as we move forward.
Great. All right. Thanks to all of you for being here. And Elliott and Rob, thanks for embracing No Shave November. Don, we got to work on you a little bit here as we progress here through the month. But first question I wanted to ask, and this is kind of a common theme question for all the webinars that we've done and all these panel discussions, is, for your organization specifically, we know that 2020 had a lot of change coming into it. So talk to us a little bit about some of the change and that your organizations have experienced leading into this year. And then also, we all know that COVID has impacted all of us. So how's your agency or organization rather been impacted by COVID? So Rob, why don't we start with you on that one?
Yeah, sure. So, it's an interesting question for us, particularly because we're a virtual company. So we didn't have to make all the same arrangements coming into the year. But two, also, we've been now, since our foundation, we were founded talking about virtual patient care, right? And so I don't know that a lot has changed just from an operational and what do we do and the message that we've been delivering standpoint. I think the thing that's changed the most is people are listening. Right. And it has a funny way of kind of doing that to you. And it's a good thing. But I think what it's really done is kind of changed the momentum from what was once thought about as a nice to have to something that's more of a need to have. Right. And really beneficial to have. And so I think that really has changed a little bit, from our perspective. I can also tell you that whenever, we talk about this, I think the noise around what we do and the number of people in the space has also gotten a lot larger, right? Everybody's hearing about this now. And what that's really forced us to do, and I think this is important, right, is to really hone in on what do you do? Telehealth is such a generic term that has been thrown around since, a lot since COVID back in March here. And so it's really, what is it that you do? I mean, that could be monitoring, that could be a video visit, which I think most people think about over the last, 6 or 7 months or so. But I think what we're really focused on and what we talk about is virtual patient care. And that is when all the things that are involved in what happens. And so we've really had to refine that message to say it's everything that's needed to take care of a patient when you're not in their presence all the time. And so that's really, I think, what has impacted us and how we had to refine and refocus this year based on everything that's happened.
Great. Thanks for that, Rob. How about you, Don?
Yeah, so in simple form, plans change. I would say that, to build off of what Rob had just talked about, Reliance underwent a transformation from being sort of a nice to have, having an LMS to make things simpler and things like that, to much more of a need to have, when staff went remote. But we're a big blended learning company. We build tools to help people with live training. And so, we were already making plans around things like a virtual classroom. And so we just sort of had to change plans and accelerate development in some areas like that to, help healthcare organizations still maintain some of that sort of face-to-face training and contact that's just so important in learning. We also, quickly had to think about guidance and making changes to our content. So some of our newer initiatives we maybe set aside, they're equally as important, but we wanted to make sure that organizations had, the right information, the right training. And we even built a free toolkit. We made it available on our website for people to, be able to access, but we also did a big initiative to push that content and have a fairly large campaign to make sure that, clients and their staff could get that information as quickly as possible. And then we also really started to see an uptick in more just-in-time and sort of cross-skill, reskill training. So we've had a lot of efforts around ensuring that we have, our libraries and subscriptions and content in a way that help these organizations, get through COVID.
Great. Thanks for that, Don. How about you, Elliott?
Yeah, so I was thinking just about the specifics, and I'll start a bit more general, that a lot of the drivers behind why you used Metalogix pre-COVID and post-COVID didn't change. And there was a lot tied to PDGM coming in, ensuring that you're delivering what's necessary for the patient, how data could help support that. That was really there in place. So from a product standpoint, we had less change. For us, and I'm sure a lot of people on the webinar felt this, like just from a very human perspective, we really had to take care of our people. So culturally, we went from a company that was almost 100% in the office every day, being together, collaborating, innovating, to 100% remote overnight. Mm-hmm. And that was hard. And so we really had to work through what that looked like. Culturally, we had the infrastructure to do that. And so we've had to invest a lot in virtual events, and there have been multiple virtual Jeopardies that we've done to try to keep our team aligned and, having fun together in addition to working. But then, the other part for us, I think, was given that we had a lot of the drivers that existed already. I would say the real, I don't know if change is the right word, but it was like COVID brought this hyper focus for us. And so one element was making sure that our employees were in good shape. But then the other was, hey, are our customers okay? Mm-hmm. And are we able to deliver in the same way if we're not able to be with them, right? Then once COVID began and it was all virtual. And so I think a big shift for us was not getting to be with customers in person anymore, and trying to ensure that we're having those opportunities virtually and that we're making the most of customers' time when we have that opportunity, because they had even more to deal with once COVID started than they did before. And so I think those would be the core challenges for us, would be people and customers, and trying to focus on those explicitly.
Yeah, we all miss those in-person meetings and conferences for sure. So I appreciate that insight from all of you. Now, in terms of the next part of the discussion, we talked and collaborated and said, how do we want to best approach this, and looked at some of the discussions and different categories we wanted to talk about specific to the role of technology. We really wanted to focus in on how agencies are using technology in the following areas, looking at number one, patient care management, number two, revenue cycle operations, and then number three, more on the engagement side, both for the employee engagement and also for the patient engagement. So if we look at those four different groupings, starting with patient care management, we know that 2020 really turned the home health world specifically upside down. First, we had a brand new payment model in PDGM, the biggest change we've had in the payment model in 20 years. And then COVID obviously threw us all for a loop. I think number one priority for all agencies is still getting patients the services that they need in order for them to really meet their outcomes. And you really, all three of you have solutions that assist in making that happen. So if the three of you could talk a little bit more about your role specifically in the patient care management role within each of your solutions. Wanted to start with Elliott on that one, if you wanted to take that first part.
Yeah, so like I mentioned before, we are a data science company, and we are helping provide guidance around care. So this is right in our sweet spot of, given the data that an agency is collecting, OASIS, medications, patient history, goals, what should a patient receive? What's necessary for them over the course of the next 30 to 60 days that helps them meet their goals and get back to a place of independence and ability to go back into the community. And so this was a very pertinent challenge, especially with PDGM coming. What we saw in the data was patients largely across the board received the same care plan. That patients that probably could have had 5 visits were getting 16, and patients that needed 40 visits were getting 16. And so there was very little necessary variability in that care planning coming into this year. And I think PDGM shined a big spotlight on the fact that that wouldn't work anymore. And I think COVID really enhanced or created this even more urgent need for that, because you had crazy things that were happening with the census. So we had customers whose census dropped 40% in a month, and you're running into some challenges there internally, economically, where there is a lot of practice that can be driven by how your staff is compensated. And so, independent of having something like Metalogix Care, you are completely reliant on your staff and the assessment and that experience. And that's not to say that Metalogix is going to replace that, but Metalogix is there to be clinical decision support and provide some objectivity around what do we actually think that this patient needs in order to get back to independence. Is that 4 visits? Is that 10 visits? Is that 30? And what types of disciplines help you get there? So that's that capability that we have specifically and how it fits into care planning, especially in a PDGM and COVID world.
Great. Yeah, I think that's definitely an area that agencies still struggle with, is trying to figure out what that secret sauce is. And it's actually our first poll question here that we wanted to ask is around visits, and looking specifically for home health agencies that are on the call, is what have your visits per episode done in 2020? When I say visits per episode, kind of equate that on the visits per period side as well. Have you seen those numbers go up significantly? Have they gone up slightly? Have they stayed about the same, or have you seen a decrease in there? So that's the first poll question, if you all could participate in that one. Rob, before you give your answer, one of the stats that you and I talked about is, according to media company IDC, in March 2020, 84% of healthcare consumers experienced their first virtual visit. I think you can kind of provide some insight there on specifically for your company, how that's shown, that those numbers have shown true as well.
Yeah, I think that's true. Look, I mean, we know that that's happening, right? There's a myriad of data out there to show that it's happening. And then the question becomes, how do you leverage that interaction with technology to be beneficial? And I think, really when you talk about how does technology do it, I think we need to get to a point to utilize technology to create more of this patient self-service kind of mentality. And that tends to be maybe a bad connotation sometimes. But what I'm getting at is, Elliott and the folks over at Medalogix do a great job with risk stratifying patients and things like that. But if you're going to manage a large population of patients, you kind of have to have tools in place where they're going to be able to give you information on themselves, right? So how do I manage that CHF patient? Because I don't have enough people to make extra calls or extra visits to them. So, getting people, if you think about it in terms of, how do we get information out very easily that people will then interact with? You engage them, they'll interact with the technology in such a way where they're giving you information that's really critical to maybe you stepping in then and then intervening to say, okay, now I can manage these people by just the early signs and symptoms that I'm getting by them providing technology to me. So when I talk about self-service, I'm really talking about ways that don't require resources on behalf of the organization, but allow you to get valuable information back from those patients in order to then take action amongst the population to help them all stay at relative low risk for those adverse outcomes.
Great. Makes a lot of sense. Don, how about over to Reliance, from a patient care management? We know education plays a huge role there. Why don't you talk a little bit about what your organization offers?
Yeah, absolutely. With things like PDGM, we were already looking at home health taking on slightly higher acuity and more medically complex cases, and I think COVID just accelerated that. It just forced that into a lot of agencies' hands really quickly. And so, I'd actually say a lot of what we were doing sort of kind of go hand in hand. And fortunately for us, we were able to leverage what we were doing with PDGM to help and assist us with COVID. So, we've been looking at building courses to help organizations, handle that higher acuity, make sure that their staff are well trained when they first get them, and help them with onboarding and things like that. We also have tools like assessments that can help you identify areas of deficiency. But as I mentioned earlier, for a lot of our organizations, it's really helping them get, just in time training out to their staff so that when something happens that maybe they're not familiar with, they don't have as much experience with, they haven't done it in a while, maybe since they left, the hospital and they came to work for your agency, getting them those resources and helping them to connect with their peers has been really important in making sure that they can provide care and maybe prevent an episode from going back to the hospital or from escalating further. So for us, it's really just about making sure that we have teams that are skilled to provide care to, the new patients that our home health agencies are accepting. And then lastly, this one's a little bit more newer, but we have some onboarding programs that we've been creating in terms of allowing agencies to take ownership of their programs. We've had a lot of conversations. Staff shortages has been an issue for a long time, and that's certainly impacting us here, right? Turning away patients or not having the right patients. So we've been rolling out onboarding programs like our home health aid program in New Jersey and in Washington right now that we plan on expanding, where an agency can train and certify their own staff. And we know that these jobs are still, hot in demand. And so we're hoping to help agencies make sure that they can maintain that pipeline of staff into their organization and then train them to where they need them to provide care.
Great. Thanks for that answer. Now switching gears, let's talk a little bit more about how technology can impact revenue cycle operations, whether it be from intake all the way to scheduling, authorization, or tracking, billing, reporting. The revenue cycle is really the key to optimizing revenue and also getting paid for the care being provided. Elliott and Rob, I know your two organizations definitely have solutions that can help facilitate that. Elliott, we'll start with you. Why don't you talk a little bit more about specifically for Bridge and also for Care, how those help tie in on the revenue cycle side?
Yeah, absolutely. And so really the revenue cycle enhancements are a byproduct of managing your patient population well, right? So from a Metalogix perspective. And so we have one product. This is a little more abstract, right? But we have one product where we're identifying patients on home health who are candidates for hospice and elevating them for evaluation, for moving them from one service line to the other, which first and foremost is what's best for the patient, but additionally has impact to revenue and impact to utilization that's potentially unnecessary. And so identifying that patient appropriately and having a very streamlined process from one service line to another is going to have this downstream impact to your revenue cycle management, especially in the downstream service line. And then Care. So Care is the utilization management product that we have. And I think we'll talk a little bit about this when we're talking about culture, but one of the things that we do or that we run into is we are creating multidisciplinary conversations today where previously they were not, especially as it relates to care planning. And so a byproduct that we're seeing with this is a lot of that multidisciplinary planning and collaboration has to happen prior to Metalogix being able to give you a recommendation. And so in order for Metalogix to give you a recommendation that you can use, you have to do that pretty quickly. And so we are seeing an evolution of that revenue cycle management because the agency has an impetus to get the care plan right, where maybe they didn't as much before. And so we have Amedisys as one of our largest customers, and we had a press release with them a few months ago where they had seen a 40% reduction in days to bill wrap, which again is not something that Metalogix is necessarily focused on, but it was a really interesting byproduct of the transformation in revenue cycle management that happens just because you are managing your patient population more efficient.
Makes sense. Yeah. Days to wrap is going to be that much more important come 2021 with the new timely filing rules in place. Appreciate the answer there. Rob, moving over to you. I know we had a webinar, the last panel discussion we had was actually focused around orders tracking, and you all have a solution that helps assist with that process as well. Why don't you talk a little bit about Applis?
Yeah, I think that's the biggest thing. Parlaying on the earlier BlackTree webinar, you made a comment about if you have an outstanding AR, it's probably a big outstanding AR problem. It's probably because of that physician order component, right? And so when you look at it, it's literally been decades that I've been doing this now and hearing, hey, if I could solve that problem, I could quit my day job, right? But it's one of those things where what we've heard for years is, hey, you know how you get them signed orders? Well, you got to send it through this system that they use or that system that they use. And I think we weren't so much hearing that, hey, I love this other system, is we were hearing that what I don't want to do is have to download another application to do it or log into a 15th portal to do it. And if so, you know what, just send me a fax, right? So, and really what you're talking about is then saying, how can you leverage technology that's out there today to eliminate that? And so, this is all a process of elimination of how do you continue to eliminate these barriers. But one of the technologies that we can provide now is leveraging something called Magic Link, which would allow you instead for even an unknown user that hasn't registered or hasn't downloaded an app or ever signed into a portal, you could get them a document for signature that shows up either as a SMS text or in their email, which is a non-PHI type of notification message that then just with a tap links them into a secure component using Magic Link where they can just sign on. So no app, no sign on to a portal. Those kinds of technologies, I think, are things that we tend to think about in the revenue cycle because of that ability to get physician signature and utilize that. I think it goes beyond that to other things that you're required to do, right? When you start thinking about how do I look at document completion for things that a power of attorney, a POA might want to do, right? But that POA is not with the patient. Then how do I use that to engage? And typically they have the same kind of complaints, right? The same kind of objections and that the physicians would, that they're just not engaged. And so you want to follow up with these people. The way to do it is eliminate those barriers and use some of the newer like Magic Link type of technology that overcomes those objections we've been hearing for years.
Great. Yeah, it's always been an uphill battle is really trying to get those signatures, and it's been compounded even more here in PDGM world where those billing periods are cut in half. So I appreciate the insight on that one, Rob. As we switch gears again, one challenge that we've always faced in home care has been turnover and staffing in general, specifically with that turnover and the employee retention. An article just came out last month from Home Healthcare News that indicated the turnover rate has increased from 2019 to 2020, going from 21.89% up to 22.18%. And we know it's becoming increasingly harder to engage with these employees due to COVID. So another interesting stat that we saw was regarding our workforces, according to a study published by both Gallup and also by Deloitte, 75% of our workforce will be millennials by 2025. So kind of the spin there is, that's a whole different segment of the population that is clearly, I would say, more technologically savvy and more embracing of technology. So we wanted to discuss kind of the role of technology and employee engagement for you all. Before we go into the answers there, next poll question is really going to be, what has turnover been for your agency? How's that been impacted in 2020? Again, have you seen an increase? Has it stayed about the same? Have you seen a decrease there? I would say we've heard questions all over the board with turnover. So curious to see what the results of that are as well. Don, why don't you start? I mean, I know a big piece of what you do and what Reliance does is really engaging with that employee. So why don't you talk a little bit more about, kind of the enhancements or some of the products and offerings and really that the benefit of using Reliance's?
Yeah, absolutely. So, when we think employee engagement at Reliance, it's a very holistic approach, right? There's the direct things we do, right? Like appreciation, that maybe a gift card, a high five, a great job. And then there's the things that are just more of a culture element, right? A friend of mine named Sandy McManus that works at Reliance, she used to be a nurse, but, a quote that she used to say is that, you have a culture, it's just whether you're driving it or not. And so employee engagement is about creating that culture, crafting it in a way that you can manage your pipeline, understand, what the culture looks like, create a positive growth-based culture, and then ensure that staff understand the resources available to them, right? And one of the things that starts with is just when you're onboarding and hiring the staff is hiring the right staff. And, you may not have the luxury of a lot of choice, but you can make certain decisions about, good, bad, in terms of as a person, right? We can help people grow to be the employee we need them to be with training and some additional persistence. So things like our assessments tool, there's a lot of people using it for, general annual competency, but a lot of people use it in that onboarding process to identify those gaps and then help people grow, right? We actually have a lot of success with some hospice agencies that have very low turnover, and they use those assessments when people get onboarded. They identify those areas for growth and opportunity, both from a clinical skills perspective as well as from a behavioral perspective, and then teach them how to be a better employee and then also show that they're invested in that growth. There's also the need for meeting staff where they're at. I'm so glad that Nick brought up the idea that, our workforce will be largely millennials by 2025, thinking of remote solutions. And so one of our big investment areas right now is around mobile application for our learning. And again, it's making education consumable. It's making it short. It's making it easily accessible. Some things are just going to be better taken on a tablet or a laptop. But if you pull some Pew Research stats, you'll find that the younger you go down the generations, the more predominantly adopted mobile devices are. And so, us investing in making sure that our content and our courses are available via mobile is extremely important. But it allows you to do things like deliver self-care, deliver development education, and deliver it to them where they are. The last thing I would mention is that it's also not just strictly about engaging your employees. It's also about your managers. A lot of employees, when they leave a job, they're leaving because of their manager. Manager leaves. A lot of times you see employees bunny hopping off with them. So, investing in not just the staff, for self-care, for courses around, employee engagement, but also in your leadership and in creating development programs, it creates a better culture overall. And Reliance has content and tools to help with all of those things.
Great. Thanks for that.
Thank you.
How about you, Rob?
Well, I think, so to just kind of focus on the employee, and I think, we really talk about retention there. Yeah, I guess I would sum it up in this. I mean, don't give your cell phone number away anymore is really our goal, right? And once you give that away, then you don't get the rest anymore, right? And so what we're really trying to do is provide these kinds of tools, as Don talked about the millennials, and Nick, you quoted that, like provide the tools to them to communicate that they're used to using today. But do it in a way that still allows them to provide their job and then walk away from their job because they all earned that, right? And if you're giving them the caring nature of this is, hey, I want to give them access, and I think that's great. But you have to do so with the employee being able to survive and live a life as well. And there is so much. It doesn't matter whether you're a home health or a hospice or a private duty organization. I mean, there's so much coordination that caregiver has to do between the scheduling person back at your organization, between managing the DME, the coordination of medication deliveries to make sure things are in, all of these kinds of things, and then all the paperwork that goes along with it, right? But managing all of those things, and then, requires today for so many people to use tools that they're not accustomed to using, and them using many different ones, right? So we're using telephone for some of that. We're using email for some of that. We're texting with some of it. We all know that texting isn't great. I mean, we always talk about that technology gap, right? My 81-year-old mother was texting to a nurse all the time. And you think, oh man, she doesn't even know what PHI is, right? So you just have to kind of center these things into a bit of a communication channel. And if I can create a communication channel that allows my DME provider and my pharmacy provider and my patient to all be on the same communication channel, instead of having to make phone calls to each of those 3 different parties and send emails, then you're going to really talk about how do I engage that employee and how do I retain them, because I'm helping them do their job in a lot less stress. And by the way, if I don't have to give away my cell phone number, it can then rely on the team to help doing things through auto escalations that other team members can help cover. That kind of technology really alleviates some of the day-to-day hassles and allows these clinicians to really just focus on their patients more.
Great. Thanks for that, Rob. And we talked about employee engagement. Let's flip that over to the patient engagement side. That also continues to be a challenge, and another area where we've definitely had to pivot a bit due to the pandemic. Another stat I'll throw out there from a technology perspective, we talked about the employees being more embracing of technology, but we're also seeing it on the patient side. According to the Pew Research Center, the ownership of smartphones for patients age 65 plus eclipsed over 50% in 2018, 2019. I would guess that number is even higher here in 2020. And the caregiver percentage exceeded over 80%. Again, same questions. Talk a little bit more about the role of how each of your companies really facilitate some more of that patient engagement and really improvement in the overall customer experience. Rob, I'll start with you on that one again.
Yeah, so thanks, Nick. I mean, this is why we exist, right? This is the whole reason that Citus exists. And just on a personal level, just after I started at Citus, a month before I started at Citus, I put my dad into a hospice, right? So we're into a long thing, and now I'm 300 miles away trying to take care and help coordinate hospice services for my dad. My mom's there as the caregiver, but I mean, to watch the number of calls that have to go back and forth to do something to get a hospital bed in the room, and that takes place between the DME and the home health and the nurse and my mom and delivery. And now for someone who's trying to manage that from 300 miles away, really tough. And so I think, it has to be a way that all those people can be engaged like we are here on this communication, where we have this omni-channel, go to the patient where they have the right technology. The technology gap's closing by what you just indicated. And as I told you, my mom was texting her nurse at the age of 81. I defy you to find grandparents who aren't on technology to interact with their grandkids, right? So you have to leverage it. And look, we just did some studies in hospice that showed that 80% of the caregivers that we surveyed over a year said not only would they pick you over another hospice if you use these kind of communication tools and engaged with them regularly, but they would also, the same 80% said that they would also give you higher CAP scores. And so big impact to adopting this, and the people were ready for it.
Great. Thanks. How about you, Elliott?
Yeah, so one of the things that we talk about a lot is patients don't want to be overly engaged either, right? And the first step to getting that right is ensuring that the care plan is right. And your grandmother doesn't want to do more therapy than she needs to do, right? At some point that just gets to be annoying and unnecessary. But I think to Rob's point, technology really plays an incredible role in helping agencies that are by their nature more virtual caregiving fulfill that role. And so the ability to identify which patients need it is really important. And then to have platforms like what Rob is talking about. So, and we do some of this too, where we provide IVR services where you can leverage that as an extension of the care plan and as an extension of your team to check in with the patient and make sure nothing's going wrong. It's extremely valuable, and we have seen very clear reduction in hospitalization just because the patient was being engaged appropriately. That's a real thing. And then the other thing that we have seen historically is that just because a patient doesn't meet Medicare eligibility requirement to be on your services doesn't mean that they're independent. And so we've started identifying patients who are likely to decline post-home health discharge. And we have a few customers that are leveraging that to do customer satisfaction and check-in types of calls. And we found that Medicare Advantage companies are extremely interested in that capability because from a payer standpoint, you're looking, and this is overly simplistic, right? But they're looking at it like a continuum, and home health is at the end of the continuum. And then once a patient gets through home health, then what? Who's checking on them? The answer is nobody. And so we've been able to assist in maybe a little bit different. It's slightly different than the way that Rob is talking about, but I think it's critical, and the technology is there to help agencies do more of it.
Great. It makes a lot of sense. Appreciate that insight from all three of you. And that leads us to our our third and final poll question here. As you are evaluating technology, what is the most important aspect to you to determine what you roll out at your agency? So you can see there are the choices there. Again, another one, I'm curious to see what the results are for that. Now, again, we're going to kind of switch gears here. We went through those different 4 categories. We really want to talk more about the value prop. I think one of the other consequences that we've seen here due to COVID has been that care at home has been under much more of a microscope and a positive light. We've heard a lot about SNF at home model. We've heard much more about patients wanting to be seen in the home. If that wasn't the case before, it's even more so the case now dealing with the pandemic. So as you use that theme and kind of the care at home value play, how do your technology specifically help promote that care at home value play? Rob, we'll start with you and then go to Don and then Elliott.
Yeah, so Nick, I think, when I hear that and I hear that care at home value play, I mean, it's interesting because I think for people who've been in this industry for quite a while, they've always been waiting for this to happen. But now this wave of people getting into the home faster. I was on a conversation with a payer last week, and they used the term the SNF diversion program, right? And that is the first time I've kind of heard that term used, but the gist is, how do I do that? And when you start diverting more people to that, I think what you really start to create, and people have talked about care transitions, but now you're talking about care transitions that are going to be exponential in volume. And they're also going to be multifaceted. We all know that you have to be a diverse provider, but I think Elliott just talked about the continuum, right? And that's really where it comes into play. So this value, this care at home value, everybody's realizing, but there still are going to be multiple participants in it. And so it promotes far more opportunities for care transitions, but communications across those places as well. And so that's the coordination challenge that comes with anytime you get outside of the 4 walls. We all know that we can be the lowest cost provider, that we can do it, but can we do it in the volumes that we're going to experience because of these SNF diversion type of programs? And then can we bring more of the providers into the umbrella and still coordinate that care? And I think that's what we really have the ability to offer. And for those people who are focusing on making that coordination effort, I think in the end they'll win out because they're going to make that transition smoother. They're going to be able to coordinate the services that are needed to provide it. You see this and a lot of flexibility coming with Medicare Advantage plans, things like that. That trend is going to continue, and I think that is all important for us to recognize and address with technology as we move forward.
Great.
Absolutely. Great point, Rob. Sorry, Nick, just hop right in. Something you just said was flexibility in, when thinking about, the home-based models. I've seen everything from, people rolling out primary care to a hospital at home to, SNF diversion. And the home setting is just ripe for innovation. And that's not just from the technology standpoint, but from what our staff are going to be asked to do and the care we're going to deliver and the models we might participate and join in. All that's going to require education and efficient education. And that's something that, you get from something like a learning provider, especially one that has a huge library of content. And so, as people are looking at different models, or maybe they're changing their case mix or looking at potentially different patients or specializations, having a learning company at your side to help you get through those changes, or to even help you have the education to make those changes happen. That's where we really come in, right? It helps to deliver that efficiency, ensure that staff can meet all the needs that someone might want and need out of a facility, but at home, right? Having the right trained staff. And then again, I say just-in-time training a lot. I'm a big fan of micro-learning and training at the time of need. Again, assisting clients with dealing with that increasing complexity and acuity, it just helps people to be efficient, maintain people in the home, and essentially help them age in place.
Great. Thanks, Don. Elliott?
Yeah, so Rob shared his personal story a bit ago. I'll share mine. So a few weeks ago, and this is specifically in thinking about value of care in the home and where the opportunities are for our industry. A few weeks ago, my grandma fell, broke her pelvis, and is not really in a place where she can go home. So we've had to do the whole thing where we found the best SNF that we could potentially find and sent her to the facility. And as a family member, it is horrific. And so we've gone through the whole thing of working kind of through that process and making that shift to facility-based care for her. And the impact to the patient it's horrific, especially when you're dealing with a 90-year-old person. Just the amount of change that they have to go through mentally is a really hard thing. And then you have the family who's not able to now see this patient, and we're doing the whole COVID thing where we're standing on the outside of the building and waving and talking to her on the phone. And while we were doing that, it dawned on me, like, this is why we do what we do. And this is why this industry exists. And the major opportunity that we have is this surely cannot be the best option. And it's not great for my grandma. It's terrible for the family. And it is costing her insurance company 10 times more per day. And so when we think about the shift that's underway at Metalogix, we really talk about, and somebody had mentioned this in the chat, the acuity is elevating. The complexity of these patients are elevating because people don't want to send their grandmother to SNFs anymore. And there is a better way. And so when we think about our role in that as a data science company, it is, as that acuity shifts over time, we're looking at new models that are going to come into play, and we're trying to help our customers identify, okay, based on that acuity, what does this patient need? And as that changes over time, how does that change your clinical practices over time? And then how are you evaluating constantly the additional services that you should provide that don't just look like the traditional therapy and nursing and home health aides, right? Because it is going to get more complicated. And you're going to have to embrace technology in order to to make that shift. And while there are a lot of challenges there, I think that that's how home health wins. At the end of the day, that's when I'm hopefully 90 years old one day, I would much prefer to be in my home. And the trajectory that we see, at least in our conversations with Medicare Advantage plans, is I think they're starting to see that too. And you look at like what's happening with Kindred and Humana, what's happening, with kind of value-based contracting across the board. Home health should win in that. And it should be the destination of choice. And we should be working as a community to make sure that we're arming clinicians and agencies with the ability to take care of those patients, especially as acuity rises. And so from that perspective, that's really what we try to do as a data science company, is arm them with that capability, and ensure that the patient, even though they're hopefully skipping a facility to go home, that they're still getting what they need in order to be there and stay there.
Great points there. Thanks for sharing, Elliott, and best wishes for your grandma for a speedy recovery. Last two questions we have here. You all talked about what your technology companies can offer, but a question I have for you all, beyond what your companies offer, what other technology should agencies be thinking about investing in now? Don, I'll start with you, then go to Rob, then go to Elliott.
Yeah, I see we're coming up with time, so I'll keep it quick. Personally, I'm a big fan of the patient engagement technologies that are rolling out. Not to necessarily throw a shout out to anybody particular on the panel, but I think that's a big deal. But if I had to say something, I would say look at organizations that are looking into wearables or like Internet of Things and getting some synergy. We like to think of this sort of play that older adults that we're particularly cared for are very technology adverse, and some may be, but there's also a huge number of them, like my grandma, who sends me more emojis than anyone I know, that are adopting technology and things like Apple Watches and have Alexa smartphone speakers. So, looking for technology companies that can help you to leverage those devices to ensure that, you have better efficient care, that you're providing better outcomes, patient monitoring, things like that. I think that's going to be huge. And that's a general 2021 and beyond trend.
Great. Thanks, Don. How about you, Rob?
Yeah, I think when I hear that question, I translate it into what do people tell me they need, right? And it's one of the things I've really seen that I didn't give much thought to, but makes a lot of sense as we go back to talking about the coordination, is there's a lot of, let's talk about delivery notification technology, right? That I think is now coming to the forefront in the medical world. It seems forever I could order a pizza and know when it's coming. But what about my medication that I really can't miss, or else there's going to be a problem? What about my equipment so that I can transition a patient from one place to another? Those are the kind of things that whenever I was just talking earlier about coordination of these things in the home, home health value prop, it all comes into it. Who can coordinate those things better, right? And take that to a home health agency level, where the number one question they may get called is, who's coming to see me tomorrow? Right? Let's automate some of this stuff that can allow the patients to get back to my term earlier, this self-service. But those technologies like this delivery notification stuff, I've seen such a huge demand for those over the last 6 months, because they just want to know the status. And then, by the way, that doesn't lead to a phone call into you if I know when it's there. And we know we can transition the patient home if I know it's there. I think it's a huge part of connecting this post-acute world across that continuum.
Excellent. How about you, Elliott?
So I've been asked this question on a tech panel before, and I'll give first a very uncreative answer, and then something maybe a little bit more creative. But just being honest, the first thing that everybody here needs to invest in is being great with their EMR.
Yep.
Right? It is a very complicated endeavor to adopt an EMR well. And to the extent that you haven't done that, you're not going to be great at this more sexy stuff either, right? And so I think the first and kind of foremost, as you're going through all the changes this year and as you're dealing with COVID and shifting stuff around, is make sure you have your blocking and tackling intact. One. Two, I think it's probably two things on top of that. One is ensuring that you're maximizing the value of that investment. That's part of what we really try to help our customers do. Leveraging the hours and hours and hours and hours of time that you pay your staff to collect data for patients, and then translate that to something that makes your business better. That capability is there, and the promise of what's possible with data is available. And so we're obviously, and me being selfish, right? Like, I think that's something people should invest in. But then I think maybe to Rob and Don's point too, it's like, given this shift to care in the home for all different kinds of patients and complexity, it's what technologies also help you expand your reach, and don't require a clinician to be in the home in order to take care of that patient every day. And so I think that would be my answer, is those three.
Great. Thanks. It definitely makes a lot of sense. I love the point on making sure you're optimizing what you're already using. It's something we see far too often, is that, through turnover or just, bad habits, that agencies really aren't fully optimizing what they actually already do have in place. So thanks for all your insight on that one. Rounding out the last question here, what's next for all of your companies? There's been a lot that we've all had to deal with here in 2020, but brighter days ahead for sure. And curious to hear what your insights are for what the future holds for each of your companies. Don, I'll start with you, and then go to Rob, and then Elliott.
Yeah, absolutely. I would say there's three key initiatives that Reliance is looking at. We are very aware. We actually ran a survey internally where we asked people to tell us their two top concerns, right? We kind of understood COVID would likely be up there at the top for everybody, so we sort of wanted to get like a layer deeper. And oddly enough, staffing shortages just nearly edged out COVID-19, just showing them right on par. So even though there's this huge pandemic happening, people still need bodies. They still need people in the floor or, in the home, right? Whether they're hospice or non-medical home care or home health, everybody's looking for those staff, primarily probably direct care workers. So we're looking at rolling out, more recruiting and onboarding, and as well as certification tools for staff, as well as career laddering. I think a huge part of this is, even if people come to your industry, they need to see growth. Especially as you start to look at those millennials, they're all about growth and trying to leverage companies that are willing to help them get to that next level. And so we're looking at reskilling and cross-skilling and career ladders and things like that. And then lastly, our mission is we strive to measurably improve the most vulnerable members of society. And, we really want to start to actually directly attack that. So we're rolling out some products to help us with therapist and the patient, through a product called Reliance Engage, where a therapist can assign exercises and create that layer of accountability with patients to track and be able to review their exercises. We just see that as another form of education, right? And showing how I can help myself at home when you can't be here. So we're really excited about that next year.
Great. Thanks, Don. How about you, Rob?
Yeah, I think for us, it's pretty straightforward, Nick. It's the elimination of, we're just keep trying to find ways to eliminate barriers to engage people, right? And so we talked about it earlier in the process where people say, I don't want to download an app. I don't want to load a portal. Great. We'll deliver appless technology to you then. We've heard about people hey, I can't do this from a technology standpoint. Okay, so we'll make it agnostic. There's things that are coming that it's how do we keep getting ways to engage? You want to use an IoT device to connect to us and then notify people on that, via results of that IoT device? Fantastic. Let's do that. If you're using Teams and things like that people are using, and you want to integrate that and say, I don't want to, I want a kind of a center communication hub. Can I take a segment that I have from Teams and place that in so that we can have all this engagement in one place? Then let's do that. So for us, It's really about just eliminating any barrier that's keeping people from engaging, because we have to get them in this engagement system and share all this information with them to be able to care for them and to be able to coordinate their care appropriately.
Great. Thanks. Elliott, how about you?
Yeah, so I would say the theme has been like the kind of digital reach potential of home health agencies and how you take care of these patients when you're not there. And so as a data science company, that's really exciting for us because we hear about things like Rob and what they're doing, and about additional data collection that's happening on a more frequent basis. And that's opportunity, right? And so I think for us, our sense is the world is really just getting started in terms of how we're creating value with machine learning and data science. And the more data we collect, the better. And so the thinking for us is to continue to explore, maybe even with partners who are already doing some of these things in the space, different data elements that we can include that give agencies better reach, and how you can incorporate that into a more virtual care model, and how basically data science can make that more efficient and prevent alert fatigue, right? Specifically. So I think the data science has a lot to offer in that regard. And like I said, I think from a machine learning perspective and how it actually impacts patients, I think we're just getting started.
Great. Guys, I really appreciate it. Lots of good discussion and dialogue. Real quick on the poll questions, the ones that are open, just so everyone knows. Stayed about the same was the most popular answer for both the have your home health visits per episode gone up or down, and also for the turnover rate, which is interesting. And the most popular answer on what is most important to you as you evaluate technology was improved patient care. I did have a good comment in the chat. Someone had made a comment that when evaluating technology, the poll didn't include regulatory compliance and ease of integration with EMR systems. So that was actually some good insight. But again, guys, appreciate all of your insight today. As a reminder to the audience, we'll be sending a recap of the webinar, a one-pager, tomorrow to anyone that registered. Included on there will be the contact information for Elliott, Rob, and Don, so that if you have questions or want to hear more about what they can offer for you all, you'll have all their contact information. It'll also include a link to a replay of the webinar. And another reminder, we're going to do one more webinar here before the end of the year on everything you need to know about the new RAP rules in 2021. I feel like we've gotten so many questions on that since the final rule came out and basically said, yes, we're moving forward, that we wanted to have another webinar on that. So stay tuned for more details on that. And if you have questions, feel free to fire them over. Again, thanks to the panel today, and thanks to everyone for tuning in and listening, and we'll talk to you again soon. Happy Thanksgiving in advance to everybody. Thanks, guys.
See y'all.
See ya.
Bye, everyone.